Greetings, students and faculty of Herzing University. My name is Robert Rudzinski, and I'm going to talk to you today about why you need to properly manage type 1 and type 2 diabetes. I myself am a type 1 diabetic. I've been a type 1 diabetic since I was at the age of 26. It came at me late, and it came at me through my family bloodline, genes. It can hit you from poor diet, no exercise, any kind of thing like that. It also hits you through your bloodline as well, like I just mentioned before. I had it on my mom's side, didn't even know that it was there, but it just kind of snuck up on me. The reason why I want to talk to you about why you need to properly manage your diabetes is because today in society, so many people think that just because diabetes is a controlled disease, that you can slack off on it. No, you cannot slack off on it. There are so many risks involved if you do slack off on properly managing your diabetes. The first thing I want to talk to you about is DKA, another word for diabetic ketoacidosis. What happens with diabetic ketoacidosis is that your blood is not receiving the glucose that it needs in order to energize your body and keep you going. When it does this and your body goes into a DKA state, you don't get the glucose, you're not getting your sugar or your energy, so your body starts building up acids. These acids then compact, go into your bloodstream, they start eating away at your fat tissue. I myself had an issue with this when I first became diabetic. I was 230 pounds, and in 4 days I went down to 136 because I did not realize I was diabetic. I went into the hospital after being very sick for about a week, and come to find out I was type 1. Moving back on to DKA, it will burn off your fat cells. You'll start losing a whole lot of weight, which is not good. It's not a good thing. Because after it goes after your fat cells, it'll start hitting your muscle tissue. And then you'll start, deteriorating even more. And it's very bad, very painful. A lot of vomiting. You can't hold anything down for the most part. And you're always tired. You always have to urinate. You have unending thirst. It's a horrible experience. Just trust me on that. The next thing that I want to talk to you about, another one of the complications, it's called neuropathy, which is another word for nerve damage. It usually starts in the fingers, goes into your toes, move up to your feet, and eventually, you're going to end up not having any kind of feeling at all in your hands, your feet, or anything. A lot of diabetics suffer from this. It happens all the time, especially if you're not properly managing it. You can also have skin complications. Now, what I mean by skin complications is it is both external and internal. The internal are called abscesses. Diabetics will suffer from an increased amount of infection. Our bodies can't, our immune systems in our bodies don't function the way that they used to. So if you get sick, you have to properly manage yourself when you're sick. If you get sick, you can get abscesses, usually in places where you sweat a lot, like either in your lower region, in between your legs area, underneath your armpits, sometimes in the back of your neck. Wherever you sweat a lot, you are going to get abscesses if you do not properly manage that. And then if you get an abscess and you don't get that checked out, it can become septic. And then if it becomes septic and goes into your bloodstream, it can kill you. Another one of the things I'm going to tell you about is called, it's eye complications for the most part. You will actually start losing eyesight and your hearing if you do not properly manage it, because it will kill and deaden the nerves in your eyes, and it will go into your eardrums, and it will kill and deaden the nerves there as well. Those are just some of the minor complications of not properly taking care of yourself with type 1 or type 2 diabetes. Some of the more severe ones that I'm about to go over right now, these are the ones that you really need to pay attention to and focus on. If it's you that has diabetes, or if it's someone you know or someone you love taking care of, whatever, you have to make sure that you properly manage diabetes. Some of the severe complications are kidney damage or kidney failure. Now, we all know that your kidneys, they filter your blood, okay? And what they do is they take all the toxins out of everything that you eat and stuff, and in your blood that gets in there, and you urinate it, or you go to the bathroom and take a deuce, whatever you want to call it. But if your kidneys fail, that's pretty much it. You're gonna have to go on dialysis. That's not fun. You got to go in once every week or something like that to get your blood cleaned out. You're going to be sitting in the hospital. Not fun at all. One of the other big complications is cancer. you can get pancreatic cancer. Diabetics also, especially in males, prostate cancer, you will get it, if you don't properly manage yourself, because your body doesn't work the same way as it has before. Women can also get, uterine cancer. That was it, sorry. You can also get different types of skin cancer, too. It's really tricky. The last one that I want to talk about is death and or amputation. Like we talked about earlier with the skin complications, if you get an abscess and it starts infecting and gets, septic or gangrene or something like that because you're not properly managing yourself, you're going to have to get that finger or limb cut off. But it usually starts in your fingers and in your toes. It will always start there first. But DKA also leads to death, because being DKA means your blood sugar is way too high. The norm for your DKA, like to not go into DKA, is your blood sugar needs to be between 70 and 120. If it's between that, you're normal. If it gets up a little bit higher, you're maybe just get a little bit of exercise in, you're good to go. But anything above 200, you're at risk. You need to go see a doctor. Either maybe you're a type 1 or a type 2, depends. Mostly if you're at 200 and you level out at 200, you're a type 2. This right here is insulin. This is short-acting insulin. You have to take it usually between 15 minutes before or after you eat a meal. The needles that you use, I use a 30-gauge short-end needle. It's very, very tiny for the most part. And I will pull this off, and here's the needle tip. It's very tiny. Doesn't hurt. All you do is you find a good place on like the back of your arm here, your thigh, or in your stomach, where about 2 inches away from your belly button, you take your insulin there. They also have long-acting insulin. You can get that in Lantus. That was called Novolog. You can also get Lantus. Lantus is long-acting insulin, which means you only take it once a day, and it slowly puts insulin through your body while you're not taking your short-acting. But otherwise, other than that, it's your death and amputation, your cancer, you got your kidney or kidney failure, eye failure. You can lose your eyes and your sight. Your nerve damage, which is absolutely horrible. I mean, I do not have any nerve damage, thankfully, but let's hope it doesn't get there. I've been properly managing myself ever since I was diagnosed at 26, and honestly, it's very important that you properly manage type 1, even type 2 diabetes in yourself, someone you love, someone who lives with you, anything like that. Because if you do not properly manage your diabetes, there are so many risks involved, and it's just not worth it. So if you have type 1 or type 2 diabetes, or you know someone who has it, and you're a friend or anything, and you guys go out to eat or something like that, and they're about to order this huge meal or something like that, and they say, oh, well, I didn't take my insulin and blah, 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 tell them that they need to pace themselves, because it's a huge risk involved when you are working with type 1 or type 2 diabetes, especially when you're living with it. Your whole life changes. So just ask yourself next time that you are going out there to get a huge sundae cone or, large size me or king size me or something over at McDonald's. If you have insulin, or if you have diabetes, just ask yourself, is it really worth it? Do I really want to possibly have to suffer, through getting, nerve damage or, abscesses, anything like that? Yes, you can control it. Yes, you can eat the things that you want as a diabetic, but you have to properly moderate yourself on what you eat. And that being the case, this is the reason why you need to properly manage your diabetes. It has to be done. And your whole life has turned around the moment that you found out about it. So, properly manage your diabetes. Care for the ones that are with you, your friends, your family, anything, anyone who has it that you know and care about. Please make sure that they know that they need to properly manage it and moderate themselves and get at least 30 minutes of exercise every day. It will change their life around. They'll feel a whole lot healthier if they're not managing it. If they are managing it, awesome, great for you guys. And see you guys next time.